Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
Hey, Angelique, I wanted to start out this week with a little bit of sad breaking news about the Chinese medicine education field. Yeah, AIMC, which is the school at Berkeley by me, announced today that they're closing. They have a campus in Berkeley and a campus in Austin. I think they originally there was another Austin Chinese medicine school that closed already.
Mm-hmm.
So they had transferred over to the AIMC in Austin, and now that one's closing as well, too. So this is it's roughly 8 schools that have closed in the last 2 years. So
Goodness.
yeah, it's sorry to start out with a little bit of sad breaking news, but again, I'm not sure about that. I just keep watching this unfold. I'm not quite sure what to make of it or what to do. But I just wanted to let you know about that
Yeah, I
news I
didn't
just
know
saw
about
today.
that. Why is this happening? Do we know? Is it all
I know they,
financial?
I think it's all financial. I think COVID really hit the schools hard, right? People didn't apply during that time. I think enrollment was down, and then I think the cost of a degree translating over to how much you'll make actually practicing. I think
Mm-hmm.
that ratio is just a tough thing to do now.
Yes, that's true.
Uh, so yeah, but I mean, this is disconcerting for the
Mm-hmm.
profession, right? Because the institutions themselves are fading at a pretty rapid clip.
Yeah, that's pretty frightening. Where did you hear this? Which source are you using? Because this didn't come across any of my news feeds. Might be
I've
plugged into the wrong spots.
Well, yeah, I don't know, but I am like on faculty at ACCHS, which is the
Yeah.
Oakland school, the last standing Chinese medicine school in the Bay Area, which seems crazy. But anyway, so they had an announcement for AMC students saying that they'll help sort them out
Got it.
as they move over.
Well, way to start the show off with a bang.
Yeah, sorry about this, but again, I don't know. Again, I'm so concerned. I love this profession so much, so I'm just concerned as again, it seemed like some anomalies, and now it seems like it's just definite pattern as it's going through school after school.
And it's interesting that you say that because I have a student that is interning at my clinic and they go to the New England School of Acupuncture and they have mentioned that the first year cohort is pretty big, like one of the
Okay,
biggest that has been in the school. I think it might be close to 60 if I'm remembering correctly, which was a big cohort. Mine was only 40.
so again, maybe that'll be good for any institutions that's healthy enough to withstand all this. As the demand for Chinese medicine continues, maybe those schools will have more enrollment. So that's maybe a really positive thing for the remaining schools.
Yeah, I hope so. They can't all
Yeah,
keep closing. Goodness.
right, right.
Okay.
Okay,
Well,
so
there we are.
okay. Sorry to start out like that, but so I just saw just before I came on here, so I just want to get that out there. But
Mhm.
actually, one of the things I wanted to ask you about was last time you were talking about doing Moxa and trying to figure it out at your office. I wonder if
Mhm.
you figured that out yet. I know a lot of people would like to do Moxa at their office, and we're going to the season, so I'm wondering if you any steps forward on that Moxa at your office.
Slightly step forward. I know what I can do is just enacting it at this point. I'm waiting on a lease agreement before I make
Uh-huh.
any further investments into the space, but a colleague of mine has investigated I don't know if it's a fumigation machine or if it's some sort of air filtration, but it's by Vivor.
Hmm.
And she tested it out because she also has to she's trying to get a space and wanted to prove to the landlord that she's trying to get the space from that the box of smoke can be handled so that it's not a nuisance to others in the space. And apparently it's quite effective and it's only a few $100s. So I'm looking into that for one of the rooms that I'm going to have in my space. I'm not making the move just yet. I want to make sure my lease is
Hmm.
solid. But that will be the plan is to have a designated Moxa room and use that probably in the smaller of the rooms that I have.
It pulls the smoke out.
That's what I understand, yeah. So
And it
that
vents it to the outside, or
I don't know where it goes. If it
uh,
goes inside, I don't think it
okay.
vents to the outside. Did not look
Hmm.
she sent me like a screenshot of the device, like the advertisement image of it itself. It didn't look like it had piping and such. She had gotten a quote on one that was much, much more expensive. That it reminded me of it reminded me of something like the Onceler from the Lorax would have, like one of those machines. Are you familiar with the Dr. Seuss story? Like that's the image in my
Yeah.
head. It was like a Onceler machine. It's thousands and thousands of dollars. But this one looks like it has some sort of internal capturing system. I don't know if it's a filter or what. So
Great.
I've
So,
got that on my deck here waiting.
okay. Once you get that and once you've tested it out, then give us a report back because that would
Sure.
be good for people to know.
It might be a couple of months down the road.
That's fair.
We'll be,
Especially, yeah, it'll be getting warm again out of Moxa season.
yeah. Well, I do have the infrared lamps as my substitution, and I have I know it's not the same, but I have the Moxa bomb, which I could
Oh
use with
yeah.
the heat lamps as a substitution in the interim.
How is that going, that Moxa bomb?
I haven't used it much,
Hmm.
frankly, so I'll tell you when I start using that.
Okay. I was thinking about for this conversation, I have like a whole bunch of role models for certain aspects of Chinese medicine. Do you have something like that that you're always trying to like emulate certain people that you know and parts of Chinese medicine?
Sure, well, one of them is you.
That's nice.
Yeah, one of them is
Uh,
definitely you with herbal medicine. Since I've been learning from Sharon Weisenbaum, I've
mm,
been using a lot of her skills and hoping to have the results that I've seen her have. In terms of classical things, I need to study more of the classics to find like a classical person to be like, I want to be like that person. But those are like my top two. I kind of keep my circle small.
okay,
How about you?
that's nice to be in that circle. Yeah, I always thought I wanted to be able to diagnose. I had a really good pulse teacher for the Shen Hammer tradition, and
Hmm.
I always thought, oh, I want to be able to pulse read like that. For Dr. Wu, right? She's so good at interacting with patients and getting into like the core diagnostic things. So I always thought I wanted to be like that. Rethinking in Chinese medicine, trying to think of through the different lenses of Chinese medicine. I feel like
Hmm.
Jeffrey Wen is a great master of that, just being able to take on different personas from different eras and try and think through that. I think that's valuable. For herbal medicine, Heiner Fruhoff is my main person for formulas. And then I think I mentioned before, I'm taking Gua Sha's class, so like
Hmm.
individual herbs and how to modify formulas. I think I'm learning quite a bit from him. I'd love to be like that kind of level. And then my teacher, the monk, right?
Yeah.
He was the most successful acupuncturist I know, so I was always trying to emulate that. I was just thinking about this. I'm always thinking about how we don't get much from textbooks for Chinese medicine, and we always have like clinical role models. So I was thinking about for you. Yeah, I think it's really valuable to have people that you want to be like in certain aspects of it.
Sure. And I guess you could add Arya Nielsen to that in terms of Gua Sha, because
Yes.
I love Gua Sha, and to be able to Gua Sha like her.
Okay, yeah. Especially, yeah, people get into that their whatever really resonates
Yeah.
with them, and then yeah, if you can emulate that.
Mhm.
Um, like Brian LaForge, my pulse teacher for the
Mhm.
Shenhammer pulse, he was so amazing at some of the things he could do. So again, it was just always it's always motivating when you can see something like that. It's not just in a textbook; it's like in a clinical situation, you can see how they can respond to things well. Mm.
Especially for
Again, yeah.
pulses, that's still mystifying. So mystifying to me. I have a patient ask me, like, "What do you think that means?" I'm just like, "Oh god." I usually will preface to be like, I'm still a pretty novice level at this, but," and then I'll give them my impressions.
But yeah, I mean, I think that takes time. Um, I think did you ever have experience with the Shen hammer pulse system?
No.
Okay. That's maybe worth it down the road or something like that
Mhm.
because it's nice in person. You spend an entire weekend or several weekends if you get really into it, and you're feeling, and then you'll have the teacher feel, and then tell you, and then you'll tell the teacher, and then they'll say, not quite that," and then just checking the different levels with someone that's done it,
Yeah.
10,000 times is, anyways, it was really valuable. And then you come out of that weekend, and then you go back to your clinic first thing Monday morning. You're like, whoa, you can really feel pulse. It's like going to like basketball camp, right? And then you come out as a much better basketball player, right? Same thing with pulse reading. It's like pulse reading camp. So
I
definitely consider
definitely
it.
need that. I definitely do. Yep. Sign me up. I feel like
Yeah.
there's thresholds into this medicine that we cross, and I didn't realize it until crossing them. But it's like there's the threshold into starting the education itself and meeting all of the challenges of learning this new system of medicine, all of the theories, the foundationals, the points, all the things and then there's the threshold of graduating and getting your license. And then there's, okay, So that's like shutting the door on school and then you're crossing a threshold into practice and learning what that's actually like on your own. And I feel like the door is kind of cracking open to the next threshold, which I think is a deepening of the medicine, a deepening of the practice, of refining of skills, of finding more people in the world, like more role models, more
Mm,
mentors, like kind of allowing the expansiveness to enter more fully because I still, just I'm a year in December, like I'm still in this little small circle of figuring out the world that I'm currently in. And so sometimes these questions that are broader and so wonderful, it's like, oh my God, that's right. That's something else I can look out to and look forward to eventually, hopefully sooner rather than later. But yeah, the list of CEUs is long. That's definitely on them for me.
that's great. What other CUs are you thinking about?
I would love to go and do a live class with Arya Nielsen to learn more about
Hmm.
Gua Sha. I really, really love Gua Sha. Anything herbal medicine related, doing maybe even studying with Heiner Fruhoff. You've
Mm,
really talked to me a lot, inspired me to look more into the formulas that he carries, and they're pretty awesome. I'm almost having like, what's the word I'm looking for? Buyer's remorse, maybe, of carrying another company's patents because now I have to get rid of all of those now. And like as I circulate in some of the classical pearls. Um, I would love to know, like, do more of the extraordinary vessels
mm,
into the extraordinary vessel treatments. I touched on in my doctoral program the different channel treatments, like the divergent channel treatments and Luo channel treatments. And I don't know that I would be able to realistically do some of those in the clinic, but it would be neat to experiment somehow. Yeah,
mm.
it's like, and I would love to do more of the classics, like eventually down the road, learn to read classical Chinese. That's like a big goal. A big one. Once I'm, I don't know, 5, 10 years from now, maybe really delve into that. Maybe sooner, who knows? But that's another kind of nerd interest that I have to be able to do some translation or at least reading of the actual original text. It'd be a neat thing to do.
Yes. Chinese medicine is like a bottomless bucket, so you never fill it
Sure.
and then be bored, right? You just
Yeah.
always so many things to go through. So it's exciting, especially at this part of your career, right? It's really exciting because you have so many different paths to go down. And so,
Exciting and
yeah,
overwhelming for that very reason.
yeah.
Because it's endless and bottomless. And it's like, which way do you go? It's like you have infinite paths you can take. So yeah, feeling that acutely.
Yeah, I'm trying to think about how I navigated that. I think like clinical gaps I saw when seeing patients, that made me want to go and fill them. So
Hmm.
anything like that, there's certain things that really resonate with me. Of course, I want to try and get more, but anything I felt really weak at. So I recognized early on, right, that huge gap for me is herbal medicine, right? There's just so much to know. The main formula set, we have 10,000 different formulas in it.
Hmm.
And then I use a couple formulas not in that set. So I mean, it's just so vast what you could
Hmm.
possibly do. So mostly that's where I did my in school, right? We had like different sister schools in China. I went to Chengdu because of the herb school, right? And then I just, you know, probably 75%, 80% of my CU classes are herbal medicine because
Hmm.
I just feel like that's just something that again, it just always get a little bit better at that. And then
Yeah.
especially seeing patients, especially when COVID came up and things like that, I think that really showed a huge gap I had in my herbal formula knowledge, right? Because like it was mostly theoretical, those really severe respiratory things
Mhm.
that we were seeing. It just I just didn't have much clinical experience with that. So again, that just made me double down on things. Yeah, I think that again, thing that you're really interested in and resonates with you, but also I think as you just start seeing more and more gaps in your clinical knowledge, I think that's going to really draw you in certain directions. Um, yeah, again, it's exciting but overwhelming. I
Yeah.
completely agree.
Yep, definitely. Do you have any interesting clinical cases from the week?
I don't have anything super interesting. I did want to say something else from the week, though. Just this first part of this week, I was teaching in Chicago, and one of the participants in the workshop 6 months ago, I taught them the intro to SOM, and
Mhm.
this is like a practicum class that we're doing. And one of the participants in there said, I was asking him how everything's going with the Jing Wells and everything, and he said he had one really good experience with one of his patients. He's like, put a Jing Well point. It's like, oh gosh, how was that? And the patient said, it's fine. It's totally worth it for the magic. And I just thought that was such a sweet thing to say. So I wanted to say that today. What
Yeah.
about you? What about clinically? What's been going on with you this week?
I had an emergency again.
Mm,
Um, had a patient come in that I see fairly frequently for GYN issues. It was a second visit this week. They came in not really feeling well, um, had some symptoms of urinary tract infection, like some emotional things going on. And so I usually treat them with some exclusively, but this time, because of the emotional component, I felt drawn to do a return to center treatment, which I learned in school, kind of cribbed off the Japanese acupuncture students. It's a midline
Mm.
treatment to
I,
help
I,
bring.
I don't know that one. What's the points?
It's do 20 yin tong, CV22, CV17, CV12, CV and stomach 36
Mm.
bilaterally as the grounding point, with the whole intention of bringing a person whose like shen is scattered kind of back to their center. I think it's also called the chakra treatment. And so I did this, and then about, I don't know, half an hour or so into treatment, they pressed the call button. I cannot stress how amazing having a call button is for patients. So press the call button. And so I came in and they said they felt like they had gotten like punched in the stomach, like around CV14 area.
Mm.
And so essentially what ensued is a lot of pain all of a sudden that happened in that area. It wasn't from the needles or anywhere that I had needled. That was appropriate, 'cause that was the thing, is like, did I puncture something? No, I didn't puncture anything. Started to appear as though they were having like a panic type situation. But the fact that they're having, central midline pain, I was really concerned about a cardiac
Mm.
issue. So I took a blood pressure and a pulse and the pulse oximetry, and the blood pressure was slightly elevated. It wasn't dangerous, but it was slightly elevated. And so I tried to convince them to go to the emergency room. And initially they refused, but then ultimately they allowed me to call family, and the family came and picked them up and took them to the emergency room, and they're totally fine. They had a urinary tract infection. No
Mm.
idea what caused this pain, but they're okay now. But that was another moment of like, okay, I'm gonna be calling 911. So it was a little nerve-wracking, but I was able to stay calm during that time. I think that's like the most important like thing that I've learned from nursing, is like, even in the midst of something that's really scary and I'm kind of scared, just to maintain calm, because people can feel that. And so the last thing they
Yes.
need is me freaking
Don't
out.
add to it.
Right.
Yes.
Don't add to the freaking out. So yeah, I was grateful for my ability to take vital signs and kind of know what to look for, know the danger signs. I wish they had gone to the emergency room a little faster than they had gone, but they went and ultimately were okay. It wasn't a hard thing. So
Yeah.
that was the most exciting thing of my weekend, or my week rather.
Do you think something about that point combination exasperated that?
I mean, it was right on the midline, and they had pain right on the midline, like between CV7 and CV12. It was like right there,
Uh-huh.
right in like where this, what is it? It's like the subcostal, substernal angle. Goodness gracious. Right where the xiphoid process is. It's
Mm.
like right there. Yeah. So maybe, I mean, I think if there it was emotional component, it's possible it was moving, in the CV
Mhm.
channel. Yeah. What do you think?
I'm not sure. Always, I mean, bedrock diagnostic thing is always the SOM system. So I always think about this midline having to do with the heart and urinary bladder. So especially with that bladder infection, could be being reflected there.
So what do you mean? Say more about that.
For the SOM system, you remember this, between
Mhm.
the xiphoid and the umbilicus is a reflection area for the heart and bladder channel system. And that line on the abdomen is reflecting those two. And so we always palpate that. If it's cold and hard, then it's more
Yep.
bladder excess. If it's soft and warm, that section, then more heart excess. Especially with the bladder infection component, I could see something being reflected in that area.
No kidding. Okay. I had not thought of that.
Hmm.
And because I have the cold hands, I'm not an abdominal palpator in this particular season of the year. Whoa.
That's hindering your
I
work.
know it's hindering my work. I need to work on that. Okay, that's interesting. So, and this is somebody I usually do some on all the time, so I could
Hmm.
have supplemented bladder potentially,
Theoretically, yeah, that might have
theoretically
been a good thing.
speaking.
Especially, just from my clinical experience that, for actual bladder infection, using supplementing urinary bladder to flush that area out and to cool
Mhm.
that fire in the bladder, that tends to be pretty successful. A lot of times I think, initially I would also prescribe herbs at the same time. Now I'm pretty confident about that. Again, if the diagnosis is correct, sometimes herbal medicine is not needed. That
Mhm. That
just
just takes
supplementing
care of
bladder.
it.
Yeah.
All
Which is
right.
nice to do, right? It's nice to
Yeah.
do, because it's better than antibiotics on the system, but,
Mhm.
we use harsh, uh, clear, damp heat herbs, and if you can avoid doing that and using just with acupuncture, I think it's great.
Yeah. Well, it's a good learning moment for me. It's one of those things like now I'm not going to forget it for sure.
I mean, it's always just pattern after pattern after pattern, and then
Yeah.
everything gets a little bit easier.
So you've seen somebody present like that that's had like urinary issues that's come up to like the mid epigastric region?
Yeah, yeah. This will present on this line, either on
Kidding.
palpation or the patient will report it.
No kidding. That's fascinating. I'm a little embarrassed I didn't think of it, but that's great. It's
Yeah,
good to know.
yeah. Just so many layers of patterns, right? And then
Yeah.
also, especially a little bit of an urgent clinical situation, right? It's easy to get a little bit off your diagnostic game, so that's
Mhm.
understandable.
Okay. Well, thanks for your insights there. Noted.
Okay,
Stored for
sure.
later.
What about other interesting things from this week?
I have another patient that I'm actually seeing twice a week, also for GYN issues, but also has a lot of body pain, has really severe environmental allergies, and she's just so deficient, just so, so, so deficient. And so has a ton of fatigue and the premenstrual syndrome slash menstrual time for her is horrendous. It's very severe liver chi stagnation. Like it's very dark, dark depression, gets a lot of pain, stagnant bleeding, the whole business. And I think like her clinical picture, the root is deficiency, and then she's got the excess stasis on top of the deficiency. And so I just started her. She used ChatGPT to diagnose herself and give herself Chinese herbs, and it wasn't all that bad, actually. Before she started seeing me, she ended up getting some tea pills and was treating herself with some success. And I was impressed. I was like, okay, but not for long term. Like it was definitely like one of the formulas is Wenjing Tong, taken like you should take it on the short term. So she was doing okay with that. And so I started treating her and we've been doing things stepwise with her. She's really needle sensitive. Like I wouldn't do some. I don't know that she'd be able to handle it. Super, super needle sensitive. So definitely very selective with points, but it took me a couple of weeks actually before I was like, I wonder if I should do Gua Sha for her. Like I kind of intuitively was like, I really want to do this, but I wasn't sure even she'd be able to handle the sensation of Gua Sha. And so I started doing that for her and it has been a game changer for her. Overall, fatigue has been better. Pain has not been as present. This is the first full menstrual cycle, and she's coming up to the point where she usually is feeling horrendous, like sick, like she gets like flu-like
Hmm.
premenstrual symptoms. And the gua sha has been amazing. Like she comes in feeling a certain way, and she walks out brighter. Like you can just see it in
Mm,
her face. And she also came in the last time that she was in with she had an exposure to environmental something, and so it was really she felt her face. She said it was just in so much pain, like her nostrils and her nose was all on fire, and she had a lot of pressure in her face. I did like a local treatment, and I don't think it was a gua sha day for her that day. So I just did like a local treatment and regular acupuncture, and she walked out and she said she was gone. Like it was much, much
mm,
better. It was better. She's like completely in relief, and she was like 9 out of 10 facial pain when she
great.
came in. Yeah. So I did Osher points. I did like she had like LA 20, out of bladder 2, and I think Tai Yang were like the main points that were really hurting her. So it was kind of fantastic. But the gua sha was amazing for her.
What do you
It's like night
what do
and
you
day.
what do you think it is about the gua sha? Like based on your other patients you're seeing, or maybe this patient, what's the mechanism? What's so
It's
effective about it?
it's moving. Like
Mm,
it's she's so stuck, and it's
mm,
moving. I think that's what it really is. And I think there's something to be said too about, like on the Western med side, it's systemically antioxidant, anti-inflammatory. And so I think it systemically helps to de-escalate a very reactive system. Like just her system
mm,
is very reactive to the outside. Like I think if I'm remembering correctly, like someone I think it might be part of Sharon Weizenbaum's teaching, but it's like if somebody has a lot of external reactivity, that sometimes that can be a sign that their Wei Qi is imbalanced or like weakened and they might need Gua Tong, something like
mm,
that to help strengthen the Ying Wei to be able to withstand things coming in from the outside. I can't
mm,
remember if it was her or as a professor at school, someone in that ilk had mentioned
mm.
something like that. But yeah, just super reactive system, super stuck. I just think it's like a huge release for her.
But the gua sha facilitates that, the
Yeah.
releasing.
I don't think it
Mm,
facilitates like anything with the exterior. I think that's like a
mm,
separate thing, but it's a huge release for her, and
mm.
it's lasting. Like, for the rest of the week. She's feeling much, much better, more than just with acupuncture. Like, it was a
That's
marked shift. She was having some response from the acupuncture, not amazing, like,
mm,
okay, I'm like, all right, it's all right. And then
mm.
adding this to it, and it night and day.
That's great.
Yeah, I really love Gua Sha.
It's nice to have a lot of tools on your toolkit.
Yeah, yeah. I mean, it's a lot of work for me, because
Yeah.
I got a good Gua Sha arm now, from doing this for a year for people. But yeah, I use it very frequently. And then there's the test that you do that didn't learn in school, but learned from Ariane Nielsen's book, where you basically press your fingers like into the upper back area, and if they leave, like, white marks are lighter than normal skin tone marks, for like, they're obvious, like if you can pull it away and still see your fingerprints, it's a sign of stuck sha, and it's a
Mm,
diagnostic for someone needing to do gua sha. And I would say the
mm.
majority of the people that I do gua sha for absolutely have that ahead of time. Not all of them, because sometimes I'm like, you need it no matter what your skin tells me, but the majority of the time there's that sign there, which was really interesting.
That's great. How long does it take to do gua sha?
5 or 6 minutes.
Okay, that's not too bad. Okay.
No,
So
it's pretty
that's
quick.
great. Big impact, 5, 6 minutes. That's great.
Mhm. Yeah, very helpful. Highly recommend.
Okay. Do you want to move on to another topic? Okay. I was wondering too, part of what we're doing in Chicago, we're doing really focusing on the medical interview.
Mhm.
And I'm wondering about how you're navigating that dynamic in the medical interview between like trying to elicit information and trying to give some space for the patient to spontaneously report stuff. How's that going for you almost a year in?
That's going well. I think I
Mm,
had that skill down when I was as a nurse. I did
mm,
visiting nursing, and I only had an hour to be with the patient, and so I learned that delicate dance of allowing people to talk while at the same time interjecting and when you can, to get the information that you need, not letting someone kind of take off on a tangent. There are certain circumstances and where I will allow on tangents, if
yeah,
people are going through it for whatever reason, have had some kind of tragedy, new diagnosis, something like that. Fine. Talk away, I'll listen to you. But I've learned how to feel out when it's okay, and how to kind of curve the conversation into the direction that I want it to go to. And
great.
sometimes it comes down to just being like, I would love to hear so much more about this, but let's focus on like what's going on here. And then once you're on the table, you can finish telling me that part of your story.
That sounds like a valuable phrase.
Yeah.
Uh, what about other things like that? Do you have any special phrases that you like to use?
Oh, there's that one. I blame the insurance companies a lot. Like, I'll say, I really want to hear about all of these other situations you've got going on, or like XYZ, because tangents abound. The insurance company really wants us to focus on this particular issue for a few minutes. Is it
Uh,
okay if we take a few minutes just to focus really on this? Or like, they've got a couple of people who tend to be on the late side. And so I will say, in the interest of making sure that you get a long treatment, let's really be like quick and dirty on this assessment. Let's just ask the questions and let's get just the facts, ma'am, and then we're gonna get on the table. Like, things like that. Like, oh,
that's really great.
yeah, yeah.
One of mine that I really like to use too is sometimes, especially they're going a lot, like a long story or really too broad than I want. I'll ask them, "What's the main theme of that?" And that something about that pulls them back, and then they a lot of times that's where I really want to know too. What's the main like energetic theme
Mm.
behind that? So that's nice to pull them back, and then sometimes it's valuable, sometimes not valuable, but it does tend to pull them back.
And sometimes I'll use action. So it's like they'll be talking, and as I'm nodding, I will go over and start taking their pulses, and like do the, and start making like the space ready that I'm going to start needling off of, just to like give them the cue, like, okay, and we're moving on here, for people who are still talking. And then I'll be nodding. And sometimes I'll even guide people over to the table as they're talking, as
Yes,
I've gotten to know them, so that it's so I'm still listening, they're still feeling heard, and I'm still giving them the treatment they need in enough
that's
time. So I'm not running over.
That's great.
Yeah.
Yeah, that's a nice way to do it. Just kind of moving along. We're going to the next phase of your treatment. We're not
Hmm.
talking about medicine anymore. We're going to do some. That's
Yes,
great.
exactly. I mean, there are still some times where I get stuck. Sometimes you've got the ultimate talkers where I don't want to be rude, and sometimes like my politeness can get in the way even now. But I'd say for the most part, I can navigate pretty efficiently in the time that I've allotted.
That's great. I don't do any insurance, so I'm not going to be able to use that one phrase.
Yeah. I mean, you could.
They know they're paying out of pocket.
No, you're right. You couldn't do that. I'm trying to think of something insurance adjacent that you could blame. You could blame your assistant. You could be like, Stephanie really needs me out there in a few minutes. We're going
That's
to have to
right.
really focus on this. Yeah.
Definitely, it takes a lot of heat for me, so I'm not sure if we can put more heat on her. So it's always great talking to you. Again, we just keep talking forever. Let's put this on the shelf for right now,
Okay.
and then I look forward to talking to you next time about some
All
more
right.
things. I'm gonna try and start out with some really positive news about the profession. So I'll come up with something between now and next time I say. Sorry to start off a little bit dark, but it's happening. It just
It's
we
what
just
it's
need to be
real.
aware and then hopefully do something about it.
All right, then. Well, I'll see you next time.
All right. Bye, everybody.